This is the Everyday AI Show, the everyday podcast where we simplify AI and bring its power to your fingertips. Listen daily for practical advice to boost your career, business, and everyday life.
How can the medical field really maximize the effectiveness of AI? It's something we hear about all of the time, in day-to-day business life. AI is everywhere, but it's also everywhere when it comes to medical, when it comes to healthcare. And it's something that, even for me personally, I've always talked about how AI and in the healthcare field is so far ahead, so many advancements. And sometimes I wonder how, and sometimes I wonder what the future of AI in healthcare is going to look like. So we're going to be talking about that today with actually the president of the American Medical Association. So I'm excited for that, and welcome to Everyday AI. If you're new here, thank you for joining us. My name is Jordan Wilson, and I am the host. And Everyday AI, it's for you, it's for us, it's for everyone. It's helping us all better learn and leverage generative AI to grow our companies and to grow our careers. So before we dive into today's conversation about maximizing the effectiveness of AI in healthcare, let's first start, as we always do, by going over the AI news. All right, so first, a former Google DeepMind researcher has launched an AI startup for agents. All right, so a former Google DeepMind AI researcher and his colleagues are launching an AI agent startup. This move could potentially compete with other AI agent startups and may align with Google's interest in developing more conversational AI chatbots. Google DeepMind has previously had high-profile AI departures, including 3 researchers leaving to start an AI lab. Other AI startups founded by Google alumni, it's a long list, but includes some big ones such as Character AI, Mistral, Sakana AI, and Rika AI. All right, next, Amazon Alexa officially has a smart AI friend named Rufus. All right, so Amazon has just launched Rufus, a generative AI-powered shopping assistant for its mobile app. Rufus can answer customer questions, make recommendations, and also facilitate product discovery, all while using AI to improve the shopping experience. So Rufus is currently in beta and will gradually be released to more customers in the coming weeks. All right, last but not least, I'd say a pretty big piece of news after, I'd say, more than a year of speculation. But Tim Cook has confirmed Apple's AI offerings are coming this year. So Apple CEO Tim Cook has confirmed during a quarterly earnings call that the upcoming iOS 18 will feature comprehensive AI features fueled by deep integration across the entire hardware-software platform. So this is in response to, obviously, these ongoing rumors that Apple is falling behind competitors such as Microsoft and Google in the AI space. So Tim Cook mentions that Apple's investment in AI and promises to share more details at the WWDC, the Worldwide Developer Conference, in June. So Cook's comments seem to be a response to just the ongoing criticism that Apple's falling behind, as the Googles and the Microsofts and the NVIDIAs of the world and Samsung, everyone's been pushing generative AI, and now in devices and phones and wearables. And, I've always said Apple is never first at the party, but sometimes they're the coolest kid, even if they show up late. So that should be some exciting news. So if you want to know about that and more, make sure to go to youreverydayai.com. We're going to have much more on those news stories, as well as a recap of today's guest, which I'm extremely happy to talk about. But as a reminder, we have so much other great information on our website. Even, probably 5, 6, 7, 8 different healthcare episodes that we've had so far. But I think today's is going to be a great one. So I'm very excited to bring on here in a second the president of the American Medical Association. So let's dive in. If you are joining us live, special treat today. I'm sure all of you have questions about how AI is being used in healthcare. So make sure to get those questions in. But now let's go ahead and please help me welcome to the show. There we go. We have Dr. Jesse Ehrenfeld, the president of the American Medical Association. Dr. Ehrenfeld, thank you so much for joining us.
Thanks for having me. Good morning. That new shopping AI assistant makes me a little frightened, especially if my husband gets a hold of it. Who knows what will happen to our Amazon account?
Yeah, like we needed any more, incentives to accidentally buy a lot more on Amazon, right?
Right.
But Dr. Ehrenfeld, well, first of all, thank you so much for taking the time to join us.
Sure.
But maybe just tell us a little bit about, for those that aren't familiar, what is the American Medical Association, and what is kind of your role as president? What do you oversee?
Yeah, well, thanks for that. The American Medical Association, household name, the largest, most influential group representing physicians across the country, founded in 1847, founded back in the day, actually, to professionalize the practice of medicine. Our mission, pretty simple: advance the art and science of medicine, the betterment of public health. And we got our roots stamping out snake oil and quack remedies, and it's come full circle with misinformation and digital snake oil and a lot of junk online that we're trying to get rid of. So we do a lot of work to make sure that patients have access to high quality care, and doctors and physicians have access to the tools that they need to practice effectively.
You know what? I love that you tied it back to kind of the AMA's origins and, going against this snake oil, because, I think that a lot of people have so many misconceptions about artificial intelligence,
Yeah.
and, in all aspects of their lives, but probably one of them is, in medical, right? It's something that we all experience. We all experience healthcare in different ways. So maybe let's just start like super high level, because I know that, pretty recently, just a couple of months ago, the AMA kind of released, some updated standards or principles on AI. Can you just give everyone just a quick overview on what those, new principles are?
Yeah, no, that's great. And the principles that we released in the fall are building on work that we've been doing for the last 6 years. Our first AI guidelines were in 2018, so this is not new for us. We're obviously trying to keep up with it, but as the space is evolving, as the federal government, through the president's executive order, is trying to create this whole of government regulatory approach, we want to make sure that we've got the right policy to engage with regulators and support patients and physicians. So the principles focus on 8 different areas. How should these tools be governed? How should we have transparency? So when you walk into your doctor's office and there's a tool that's being used on you, should you know about that, right? That the AI is there. What should we require in terms of disclosures about the technology and its use itself? There are some special considerations, obviously, for generative AI and large language models that are in the principles. There are issues around liability. So if you use a tool, or your doctor uses a tool and something goes wrong, right? There's a hallucination in an LLM that causes you harm. Well, who's holding the bag, right? When there's an injury to a patient, there's stuff in there about privacy, data privacy, cybersecurity, and a little bit of attention to third-party payers, those insurance companies who are using algorithms we know every day to make decisions about who gets care, who doesn't get care. And we're very worried about the potential use of AI in those algorithms that could potentially harm patients. So that's the quick snapshot of the principles. There's a lot there. It's all free. It's on our website, ama-assn.org, if people want to check it out.
Yeah, absolutely. And we'll be linking to all of those kind of the different areas that you talked about in the updated guidelines. But, one thing that you kind of mentioned there at the end, Dr. Ehrenfeld, is the decision making, right? Making sure that, third parties are using artificial intelligence in a responsible and ethical manner. Can you just talk a little bit about what are the challenges of even when you have to look at all of the different ways that, because the AMA is, it touches patients everywhere, throughout the country. So what are some of the challenges with these new regulations and, the enforcement? Because, now I think more than ever, data and security is on everyone's mind. So what are the biggest challenges in actually enforcing that and making sure that, kind of these protections trickle down?
So the biggest challenge is we don't have a regulatory framework today in America that can effectively manage this technology. So there's 2 spaces. There's the regulated product space that the FDA has oversight over, and that will only be a fraction of the market for AI-enabled digital tools that are in the health and wellness space. And then there's all the consumer-facing product stuff. So I was at the CES meeting in Las Vegas, and not only do we have flying cars and robots and all of the big TVs, But CES is now the largest digital health meeting in the world, and there is a flood of consumer-facing products that won't fall into that FDA-regulated product space. So as the government tries to figure out what does it need to do to make sure that we only have safe and effective products that are actually helpful in the marketplace, we've got a lot of work to do. And our standpoint is that health AI ought to be designed, developed, and deployed in a manner that is ethical, equitable, responsible, and transparent. And if we're going to make sure that happens, there's going to have to be work done on the regulatory side.
Since you brought it up, I'm just curious, right? Because we're all looking at CES. If you care about technology, if you care about AI, I think everyone had their eyes on the conference there. Even for you, what kind of caught your eye? When it came to, I'm sure there's a lot of medical related companies there, who are launching new products or software. What caught your eye specifically when it came to AI innovations in the medical and in the healthcare space?
The one product that really blew me away is an Italian company. They make high-end glassware. I don't wear glasses, but they have a set of frames that look like a beautiful set of Italian design frames. They only come in black right now, but they've built in an AI hearing assistive technology. The frame is no larger or wider or thicker than a pair of glasses you'd buy today. But what happens is whoever you're looking at in a crowded room, across a dinner table, in a conference hall, is using some amazing technology to hone in on just that voice and amplify it using bone conduction so that you can hear crystal clear the person that you actually want to have the conversation with. So for people with mild to moderate hearing loss that may not be eligible or need a hearing aid in a regular setting, you think about what that kind of technology can do and how that can be incredibly helpful. So that's obviously a consumer-facing thing that is not likely to be regulated by the FDA, but potentially very helpful for lots of people like my father-in-law, who sometimes has a hard time hearing what's going on when people are gathered around the dinner table.
Yeah, I think there's so many ways like that you might think, this is a nice little upgrade or a nice little product. But yeah, I mean, there's so many things that can be incorporated into hardware that can really be life changing. One question I had. So you talked here in November, updating these kind of AI regulations that were in place until 2018. I'm curious, even in the last 5 years, because artificial intelligence obviously isn't new in the medical field, but how much has the AI innovations changed in healthcare in just 5 years since that last update to those AI policies?
Well, two things have changed. One is we're moving quickly. 38% of U.S. practices are using AI today. Now, it's not for the sexy stuff. It's not for diagnosing Jordan's problem, your stomach ache. It's for back-end office operations, supply chain management, scheduling, billing optimization. But the clinical applications are coming quickly. The challenge for us is that they're point solutions, right? There's a very specific tool, a very specifically optimized algorithm for one area of one part of clinical practice. What we're starting to see emerge and where we really need to go if this is going to work at scale are AI platforms with multiple use cases that are more flexible. That's starting to happen. There are a lot of companies working on those kinds of products, but there are still some really, really helpful things. So I will tell you, one of the most widely used types of products right now in healthcare in a professional setting is in ambient dictation. And this is not really exciting for patients necessarily, but it changes the interaction markedly. And so ambient dictation, just for people who don't know, different versions of this, but often, a small device with a microphone that's sitting in the exam room so that when I walk in to see a patient, I don't have to type the note. The note is generated automatically in a beautiful, pristine format, using a large language model on the back end, or sometimes there are companies that use LLMs to do the first pass, and then they have scribes that are cleaning the note up so that there's a human in the loop who makes sure that the note is perfect. Those technologies, and there are a bunch of studies on this, are saving tremendous amounts of time. And I'm aware of at least one circumstance where a physician who got one of these devices, one of these products that integrates with the EMR, so they don't have to cut and paste, it just shows up, cried because for the first time in months, she got to be home with her family for dinner. She didn't have to sit after hours typing all of these notes. And patients, imagine having your doctor actually look at you as opposed to typing away on the keyboard when you're talking about the things that are most important. So there are places that these models are going to be so helpful. We're only scratching the surface today. We want to make sure that we get the regulation right so that we don't stifle innovation, but that we have safety parameters for patients and physicians alike.
What you brought up there, I think it's actually worth exploring a little bit more, because even when I talk to, business leaders not in healthcare, they say that exact same thing is one of the most impactful things for their work, right? So if a lot of people are in, Zoom meetings all day and, you're either typing notes or you're having to spend, so much time, afterwards trying to follow up with all of that. How has even just that one aspect right there, bringing the, kind of voice dictations and large language models into, offices across the country, how impactful do you think that actually is? And, how does that improve the quality of healthcare or maybe even patient outcomes?
I think it's really impactful. And look, physicians, nurses are burnt out. We've seen the data. It is awful. At the peak of COVID, nearly 2 out of 3 physicians were experiencing symptoms of burnout. People saying that they're going to reduce their hours, leave the profession. We already have a workforce crisis. I don't know last time, Jordan, you tried to find a new primary care doctor, but good luck. We do not have enough people to deliver care today the way that we've been delivering it for the last 50 years. The only way we're going to get out of this crunch, it's not by doubling the size of medical schools and nursing schools. We're already doing that, and it's not helping. It's not fast enough. We're going to have to lean on the technology to boost the capabilities of our teams, to augment our capacity. And that's actually why anecdotally, the AMA likes to talk about AI in a healthcare context as augmented intelligence, not artificial intelligence, because we really don't see it as a replacement for our healthcare teams. We see it as a force multiplier. How can I see more patients more efficiently, more effectively using these tools?
What you brought up there, I think, is extremely important because, especially, post COVID, I think so many people in the healthcare industry, are, yes, experiencing the burnout, like you just said there, or maybe, everyone else is just more aware of, the stresses that are on, nurses, physicians, et cetera. How specifically, aside from, that example that we just talked about, kind of having your doctor notes, dictated. So, your doctor can, really focus on providing better care and to be less burned out. But what other ways can AI actually help, in the future, or maybe other, technologies that might make their way into, whether it's the back office or, actually in the room between physician and doctor, or between physician and patient. So what are other ways that, we might see some of that relief?
There are so many circumstances where, we have electronic health records. Theoretically, I should be able to find anything I need about a patient when I walk in. That's not what happens. And let me just give you an example. I'm an anesthesiologist. I walk into pre-op holding. I meet a patient I'm going to take care of for surgery. I go through all this stuff. I think I'm a pretty sophisticated user of electronic health records. I've looked up her chart. I go in, I wrap up. I'm about to walk out, and she goes, "Oh, doc, one other thing." And I said, "Oh, sure, ma'am. What is it?" She goes, I just don't want this time happening what happened the last time. And I said, "Well, what happened last time?" She says, "Well, I had a cardiac arrest in recovery." And I was like, "Whoa, what? Tell me about that." So she told me about it, and I went back, and buried in a nursing note, not in any structured field, not in any place that I thought to look, was, yes, this woman had an arrest. And it was obviously very relevant to what we were about to do. And you can imagine a future where these AI tools could surface really important information that's context specific. Unfortunately, interoperability and electronic health records talking across systems and health information exchanges has created accessibility of data, but it's a data deluge. It's not information that's actually actionable or helpful. So you can imagine how AI could help sift through the chart in ways that could elevate information that would be much more relevant and important for the person at the point of care.
And I'm sure that has to be a challenging thing, right, for physicians all over the country,
Yeah.
knowing what, especially generative AI, you mentioned, that's unstructured, like structured data can probably be a little easier to work with. Unstructured data, yeah, there's probably other, things that you have to keep in mind. But even when it comes to, the protected health information, that's a big thing. So how do you balance, right? How do you balance the need for smarter technology with AI? There are some great capabilities that you can implement. So how do you balance that with the need of still protecting that data? Because that's obviously some of the most important data any person has is their health data. So how do you balance that?
Well, it starts with transparency and knowing when a tool is operating and knowing when your data is leaving a protected environment covered by HIPAA and not. And I'll give you the two examples. So imagine I walk into an operating room and I turn on a ventilator and I'm giving anesthesia, and that ventilator has an AI algorithm built into it that's trying to optimize the ventilation parameters, the rate, the tidal volumes, the pressures. And I don't know that it's doing that, and something goes wrong. How can I step in as the human in the loop who's the ultimate backstop to make sure that the patient's not harmed, to supervise and correct, if I don't know that there's an algorithm operating? But we've seen this happen in other industries, like with the 737 MAX, right, where we lost 2 aircraft tragically because Boeing put in an AI safety system that the pilots didn't know about. Wasn't in the operations manual. Nobody got training on it. We can't do that in healthcare. So we've got to have transparency when these algorithms are built into our workflows. The other issue is privacy. So, people think HIPAA solves everything and it protects your data. Well, it does for a covered entity, but as soon as you authorize an app to have access to your health data that's not a covered entity, right? They don't deliver healthcare services or engage in a way that they fall under those federal protections, the cat's out of the bag. And there are opportunities that the federal government, frankly, has not really availed themselves of to put in consumer protections so that when you allow your health data to go outside of a HIPAA protected environment, you have awareness of that. And that's something that I think is going to be really, really important when I think about how transparency needs to be used to protect patients and their privacy.
I think the HIPAA aspect is obviously is huge, right? When it comes to ethically using data. But I'm curious, because even for me personally, right? Like, you kind of alluded to earlier, like, well, when was the last time you tried to find a primary care? Well, not recently, because I know, at least for me, it can take months to see a primary care physician, which I know they're overloaded. The system is overloaded. Might there be a time in the near future, right, where I can say, as a private individual, I can say, yes, healthcare company, access all my data, but allow me to, or maybe allow my doctor to have a conversation with my data, or allow me to, kind of similarly to, this, Rufus Amazon assistant that we talked about for shopping. Might that come where we have more, personalized AI models that patients can chat with, that has access to all of their data, but that is still somehow, pseudo official through the healthcare organization? Would that ever be, something we might see, or is there just too much risk in something like that?
We're already seeing it, and what we're seeing though are relatively narrow use cases. So there's a company out right now that is developing basically a virtual nurse, but it's not a nurse that's diagnosing. And the company is very clear about this. They're not there to diagnose. They're not there to treat. They're there to engage patients to make sure that when they're getting ready for surgery and they have that phone call a week out, that they get all the information that they need. And it's trained on thousands and thousands of actual conversations with nurses. It has access to the medical records, so it knows things about you to bring into the conversation, and it learns. So if you talk in the first conversation about how you're worried about your pet or something, that comes up the second time that you talk to it. So those kinds of technologies that can really help on the engagement side, I think, are really, really promising. Obviously, we want people to take ownership of their health. And that means that we can leverage potentially these generative tools to engage people in their conversations in ways that we've never thought possible before.
Are you still running in circles trying to figure out how to actually grow your business with AI? Maybe your company has been tinkering with large language models for a year or more, but can't really get traction to find ROI on Gen AI. Hey, this is Jordan Wilson, host of this very podcast. Companies like Adobe, Microsoft, and NVIDIA have partnered with us because they trust our expertise in educating the masses around generative AI to get ahead. And some of the most innovative companies in the country hire us to help with their AI strategy and to train hundreds of their employees on how to use Gen AI. So whether you're looking for ChatGPT training for thousands or just need help building your front-end AI strategy, you can partner with us too, just like some of the biggest companies in the world do. Go to youreverydayai.com/partner to get in contact with our team, or you can just click on the partner section of our website. We'll help you stop running in those AI circles and help get your team ahead and build a straight path to ROI on Gen AI.
It's almost like you were answering this question before it even came up, but very much related. So, Tara here is asking, and thanks for your question. And if you have one, please get it in. But Tara's asking, how close are we to developing that, big Hero 6, type, where there's this, nice kind of friendly robot companion, but how close are we to something like that? You said that there's kind of, some of those technologies being worked on or some being, kind of rolled out, but how close are we to that? And is that kind of where we're headed?
So look, I think these virtual agents are very interesting. They have specific places where they'll be helpful. There's a lot of research about, autonomous agents and lonely elderly people who don't have family and providing support. And I think those use cases will have a place in society in the future. But AI will not replace physicians, but physicians who use AI will replace those who don't.
Yeah. I'm curious, even for yourself, how are you using AI in your practice? And, I'd love to even just hear your perspective as a physician, how has that changed things, for you, for your practice and for your patients?
So the place that AI has come into my practice personally is mostly behind the scenes administrative simplification work. So, our healthcare system now is using some AI tools to just help with filtering messages, the inbox, making sure that as we're interacting with patients, we can more effectively and more efficiently respond to all of the hundreds of thousands of messages that are peppering our physicians and myself included. Our practice is also using some of these tools sort of for back-end billing operations and scheduling and supply chain management. I don't use it, but I have colleagues in imaging, radiology, and cardiology who are using point solutions to assist with, reading films and doing image interpretation. And those kinds of cases are becoming much, much more common. And I think it will be not long where we have a future where most images are read primarily by a machine, with a human then doing the overread to understand where things need to be looked at.
Yeah, it's fascinating. It's fascinating to see that. Even with things as simple as Chat GPT. I know a lot of people. There's a very famous kind of post that went viral about the new vision capabilities, correctly identifying certain breaks on X-rays. So not going to get into that because I don't think people should be probably using Chat GPT as a doctor at least. But what though should patients though keep in mind about AI? Because I'm sure in the coming months and in the coming years, they're going to see at their healthcare systems, they're going to start to see little offerings pop up that hopefully helps make the patient physician experience better. But what should patients keep in mind, or what should they know about AI from a medical perspective?
So I think the first thing is that if you put your private medical information into ChatGPT, it is not protected. So that is a bad idea. Please do not do that. So there's just how can you protect your own information? And obviously by treating it with love and care and respect and keeping it confidential is important. So don't give it away to any app that you download without really understanding where that information is going. That's the first thing. The second thing is really, companies are going to need to earn the trust of consumers. And that's only going to happen if they, adhere to best practices, treat data with care and respect, and are transparent about what they're doing. So if you're going to use one of these consumer-facing applications that's not really designed for a healthcare professional, look who's making it, where it's coming from. And if it's a company that is reputable and there's transparency about what they're doing with your data, you're probably going to have a higher likelihood of engaging in a successful way.
Great question here from Brittany. Looks like she's a BSNRN. So Brittany's asking, what are your recommendations for approaching clinicians who are doubtful or maybe not on board with AI? Such a great question. Like so whether it's a nurse or someone, who's working back in an office, how do you, approach someone and maybe talk to them about that?
So look, we did a nationally representative survey of physicians in August. We released the findings in November. 40% of physicians in the US today are equally excited about AI as they are terrified. So, if you're curious and maybe you think there's something there, but also a little anxious, you're not alone, right? That's where we are today. Because look, physicians, nurses, we've all been burned by bad tech. Right? Like the rollout of electronic health records was the most painful experience. It was the number one physician dissatisfier for years running because of so many usability issues, because of so many workflow disconnects. And yet we had billions of federal incentive dollars driving the adoption of a technology that just wasn't ready for prime time. So I think there's a little bit of a lingering reluctance because of that experience. A lot of hype, a lot of promise, a lot of money going towards the adoption of these technologies. So we want to make sure that we've got technologies that work. The AMA has put a ton of effort into creating an innovation ecosystem. We have a Silicon Valley-based innovation company, Health 2047. We have our AI principles. We have our blueprint for health, which is how do you have equitable innovation, including AI. We have our Physician Innovation Network, which, by the way, free online platform. There are 18,000 people on it plus now. It's a way for healthcare professionals, trainees, and companies to connect, to have those conversations about how do we get really, really good products into the marketplace. So if you're interested in any of those places to plug in or find resources, again, you can check out the AMA's website.
Oh, that's fantastic. We'll make sure to definitely include that one in the newsletter. Free resources that educate, I think, very, very much needed across all sectors. But so Dr. Ehrenfeld, we've talked about a lot in this episode. So, we've talked about, the updated AMA guidelines on AI, the importance for protecting data, kind of where the industry is headed in general. But maybe what's your, as we wrap up, what's your one most important takeaway or your best piece of advice, maybe for both patients and for physicians when it comes to maximizing AI in the healthcare space?
So I think we have to recognize AI for what it is, and realize that there are certain things that we should just never ask AI to do, like launch a nuclear weapon, right? We should not ask AI to be the be-all, end-all replacement for a physician or a nurse. We should use it to boost our capabilities. You shouldn't use ChatGPT to do math. If you ask it 13 times 24, it will give you the wrong answer, right? Because it's just trying to predict the next word. As long as you understand what the tool is doing, its limitations, and where it can be useful, you'll be in a good spot.
Oh, such great advice. This was a fantastic conversation. Dr. Jesse Ehrenfeld, president of the American Medical Association. Thank you so much for joining the Everyday AI Show. We really appreciate it.
Thanks, Jordan.
Hey, as a reminder, so much good information. Dr. Ehrenfeld mentioned multiple AI resources and education pieces. We're going to make sure to throw that in our newsletter. So thank you for joining. Thank you for tuning in. Go to youreverydayai.com, sign up for that free daily newsletter. Thank you for joining us, and we'll see you back for more Everyday AI. Thanks, y'all.
And that's a wrap for today's edition of Everyday AI. Thanks for joining us. If you enjoyed this episode, please subscribe and leave us a rating. It helps keep us going. For a little more AI magic, visit youreverydayai.com and sign up to our daily newsletter so you don't get left behind. Go break some barriers, and we'll see you next time.